The rotations that I did at the hospital in Wang were particularly good at gaining skills. So Wangaratta is really supportive at helping junior doctors to apply their skills, and there's not a lot of people, I guess, fighting for experience in the same areas. So lots of procedures that potentially you would have had to wait a few years to get to do, people guide you through them at Wang. And I guess that's probably most evident in the emergency department where, for example, you would often be taught how to do arterial lines, and doctors would be coming up from the city who'd maybe not done even as many as you in your intern year, and they were 4 or 5 years out in their training.
So some of the things that have been really good about studying and working in the country are the really close relationships you build up with your peers and your supervisors. You tend to get to know them really well. It's quite hands-on, so as a junior doctor at Wangaratta Hospital, sometimes we don't have as many seniors above us, so we'll be called in to rise to the occasion and do things that I would doubt that you'd be asked to do in a city hospital, and we're well supported in that, but it does ask us to step up a little more quickly than perhaps you would in the city, and that's really good for your confidence, it's good for your learning.
I just came from theatre after delivering a baby. A really cool experience that not many of my peers get to do as a junior doctor, but adds to the fun of working in a rural country hospital.
I'm often asked when I go to job interviews, why Wangaratta, or why do you want to be a rural doctor? And it's sometimes difficult to answer because I think, well, why wouldn't you be? It's been a wonderful experience. I would recommend working in the country to anybody. It's a great place to study. You form close relationships with your peers and your supervisors. You really get to know your patients. You get a lot more responsibility a lot sooner. It helps your learning. I think it helps your development as a doctor. You mature a lot faster in the country. I think it's a lot less stressful as well than working in the city. You don't have the problems with the commute. I live in a place where Melbourne people come for their holidays, so I wake up on the weekends and I'm already where everyone would like to be for their holidays, I think. We've got wineries and ski fields and lakes, and it's just terrific.
My favourite things about working in the country are the variety of patients I get to see every day, the autonomy and independence I get in seeing the patients as a junior doctor, and the continuity of care I also get even in an acute hospital setting. You really get to know your community.